I receive a lot of emails from listeners interested in genetic careers, and I love connecting and providing resources. One of those is Keck Graduate Institute's genetics programs in Southern California. KGI offers a master's degree in genetic counseling, as many of you know, but for those of you looking for something slightly different, KGI also has a first-of-its-kind graduate program in genomic data analytics. This 2-year master's program gives students the opportunity to work side by side with applied life scientists and future genetic counselors while gaining hands-on experience with technology and information that are revolutionizing the future of medicine. Learn more about the program by visiting kgi.edu/DNA today. Again, that's kgi.edu/DNA today.
How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA. We're all made of the same.
Hello, you're listening to DNA Today, a genetics podcast and radio show. I'm your host, Kira Deneen. On this show, I explore genetics and how it impacts our health through conversations with leaders in genetics, such as genetic counselors, researchers, doctors, and patient advocates. My guest today is Dr. Daria Julkowska, the coordinator of the European Joint Program on Rare Diseases, which is newly established last year in January 2019. Daria is of Polish origin, but she lives and works in France for the last 18 years. She has a PhD in molecular biology and is involved in rare disease research and management for 10 years. The European Joint Program on Rare Diseases represents 89 partners across the EU and beyond. Internally, the partners include research funders, research institutions and infrastructures, hospitals, and of course, patient organizations. The program is financed by the EU and the states participating in the project. Thank you so much for coming on the show and joining me to celebrate Rare Disease Day month. Really appreciate being able to hear your insight coming outside of the U.S. So thank you so much for coming on the show.
Thank you. Thank you very much for inviting me. It's really a great pleasure to be here and to be able to present a little bit, talk about what's happening also on the European side.
Yeah, definitely. And I think rare diseases is something that I've covered a lot on the show. And for Rare Disease Month and Rare Disease Day, I always try to have something that's really relevant to the community and research. And so it's fantastic to have you on, especially as a different view of I've done a lot of things in the U.S. So this really kind of rounds out more. And I wanted to also congratulate you for being awarded the Eurodisc Black Pearl Award, which sounds like really something to be, it's an accomplishment. So can you tell me a little bit more about this award?
Yes. Well, first of all, I'm really, really honored to receive this award. So this is actually this is an award that is being given by EuroOrdis, which is one of the biggest patient organizations that represents more than 900 patient organizations from more than 70 countries. So, to receive this award is really very special because it means that really your efforts are recognized. And for me to receive it, this year for the leadership, so it's an award for the leadership. It's really a recognition not only of, I would say, of myself, but really the whole rare diseases community and all the partners that are working with me on the European Joint Program on Rare Diseases. So it's really great.
It's very exciting, and you've done so much in the field for rare diseases and research and management. And one of your roles is as the coordinator for the European Joint Program on Rare Diseases. What is this program, and can you give our listeners like a little tease on what your goals are and how you came together?
So the program is actually quite new because it started only in January of this year. So it has only about 1 year. But actually, it's something that stems from many, many years of working together in Europe and actually beyond. So this program actually brings together different types of stakeholders in rare diseases field. And its role is to create like a kind of a ecosystem for rare diseases research, so to accelerate rare disease research and obviously for the benefit of patients. So the program brings together on our side the funders, universities, research institutions, but also hospitals, the so-called European reference networks, and of course patients and also European research infrastructures. So these were different actors that were actually identified as key actors in the field of rare disease research. And the idea was really to bring them together, to take stock and advantage of everything that, in a way, we created through more than 15 years of collaboration under one umbrella, and to be able to accelerate it further and to develop whatever is necessary, to even improve this ecosystem. So this is the whole idea behind the European Joint Program on Rare Diseases.
So it's fantastic that you're able to bring so many people together on this. And it's not just, researchers and patients. You're bringing in so much more to really be like a network and community. And you mentioned you're founded in 2019. Was there a specific motivation for you to start it at that time as opposed to a few years ago? Did something change, or was it like, oh, wow, we can just come together at this point?
Well, actually, I would say it was a combination of two. One thing was that really what was considered that the maturity of the rare diseases community and different programs came to a point where we found that this is the good moment really to start this kind of adventure. This was actually, of course, it was not being done, like an idea that just popped up in somebody's head. It was a real discussion and negotiation between the member states and also between the European Commission. So there was a lot of, talking, a lot of preparation, and actually it took us more than 2 years to prepare the program. But so I would say that, there was this maturity, but also the negotiation and discussion on how we want to do this for the next, how do we see the rare disease research and for the next years in Europe.
And it makes sense that it took a couple of years to bring so many people together and so many countries. Who you mentioned types of organizations and companies and institutions that are involved, but what are some of the countries that are represented in this? It's quite a few from my understanding.
Yeah, so in total, there are 35 countries that are being represented in the EJPRD, because we call it EJPRD. It represents actually the 27 member states of the European Union are represented there, but we also have what we call associated countries, like, for example, Israel or Turkey, that are also part of the consortium. And also our friends from Canada, because actually we have a very good collaboration with Canada and the Canadian Institute of Health Research, but also its, I would say, equivalent from Quebec are part of this collaboration since many, many years. And so they decided when we proposed that they joined the European Joint Program on Rare Diseases, that they were, of course, on board with us.
And having so much collaboration, you're really able to work together on bigger goals than if you were just countries doing this alone. Are there any specific goals that you have in terms of the rare disease community, any landmarks you're trying to achieve of milestones?
Yes, so actually we are following the goals that were established by the International Rare Diseases Research Consortium. So this is the consortium that really brings a different type, again, of stakeholders, the funders, patient organizations, but also industry, to work together, let's say, on a common strategic agenda. And this is being applied worldwide. So the goals that were established in 2017, actually, and these are the ones that we also, as the EJPRD program, we try to, let's say, fulfill. We want to contribute to their achievements, are to bring any patient with a rare disease, any patient with rare disease should receive a diagnosis within a maximum of 1 year of coming to medical attention. So it should be a diagnosis or a therapy, or in case none of them is possible, then the patient should be integrated in what we call the research pipeline. So that's a very ambitious goal. Then, of course, there are some kind of, let's say, so this is the vision of the International Rare Disease Research Consortium, and there are some more specific goals, like, for example, bringing 1,000 new therapies for rare diseases by 2027. Or developing a dedicated methodologies to measure the impact of rare diseases on patients, on society, but also of the therapies, for example, on patients and society. So these are the very ambitious goals. We want to fulfill them by 2027, which comes very fast. But we realize that actually, if we do not establish an ambitious goals that are ambitious enough, then the community, and especially, let's say, funders or industry, will are, let's say, less motivated. So we already practiced this before, and we realized that establishing very ambitious goals actually helps in advancing the progress for the rare disease community.
It helps to push people so that you're really trying to get to those goals, so that you're really able to achieve a lot. I mean, 1,000 new therapies by 2027 is very ambitious, as you said, but such an exciting goal, and one that I think the rare disease community is really excited by and motivated themselves. If we have so many different organizations by themselves that are coming together and able to then contribute to this larger goal. One thing that I heard about is the RD virtual platform. How does this play a role into all of this? What is this virtual platform?
So one of the important things to be able to advance on rare diseases research, but also diagnosis and healthcare, is the question of data and resources. So this is something that actually is, I would say, a very hot topic, but because of the fact, that today we are producing, let's say, data everywhere and all the time. So we have now also sequencing of human genomes, and this becomes really also more like a standard practice, or more and more standard practice also for healthcare. So what we realize that for rare disease, where you have so few patients, for example, being able to pull together the maximum of different type of data and resources. So it's not only about the genetic data, but it may be also other type, let's say, of omics data, like proteomics or metabolomics, or epidemiology data, or toxicology data, or the data coming from clinical trials. So the idea is, to be able to have all this data available and pull, let's say, again, available in one place. So this is what we are aiming at with the EJPRD virtual platform. So the idea is obviously not to have, like everything in a one physical place, but because that's not possible. But the idea is to have first what we called all this data fair, and the FAIR stands for findable, accessible, interoperable, and usable, which means that by coming to the platform, you will be able to find the data, so you will know where they are, you will know what are their accessibility conditions, but also these data to be able to exploit them, especially for research and diagnosis. It means that they need to talk to each other, so that's why they need to be interoperable. And of course, it means that they need to be reusable, because you do not want to lose the data, for example, that were collected in a specific clinical trial. They may be still reusable to progress for further research. So that's the whole idea behind the European the EJPRD virtual platform.
So you're able to take this data, and instead of using it just in one facet, you're able to apply it to so many different areas. And like you mentioned, big data is something that is increasingly sort of a problem, that we have so much data and we're able to collect it all, but the interpretation is really the hardest part. And you mentioned it's not just, genomic information, it's all kinds of other types of information that we're looking at and gathering on someone. And so the ability to share this information is huge. I mean, there is this movement like #ShareTheData, so that scientists and the scientific community is able to further progress, so that we can actually work together and not have separate companies working on the same thing, but we all have the common goal. We all want treatments and cures and to be able to diagnose, which is another thing you talked about earlier of being able to diagnose much earlier. I mean, if we can diagnose within a year, that would be amazing. I'm hearing it takes many, many years for people to be diagnosed. I've heard like 6-7 years being thrown around as maybe an average, but this sounds like really exciting. Can anyone be part of this? Do they have to be part of an institution? Can they just be a patient advocate that's operating on their own?
So the way the virtual platform, because now it's under construction, so obviously, as you can imagine, there are already some, let's say, big deposits of data that are already available or existing. So what we are starting with is actually to pull these together. so this is what is now being constructed, and then progressively, once this is going to be open, it will be open for anybody, for the research community, for any person who would like to access this data. Of course, this doesn't mean that it will be like freely accessible to any person, because we are talking here, of course, also of different levels of data. So it may be the metadata, but it may be also the data of, let's say, patients or people. So you need to set up also the levels of accessibility and the rules for accessibility. But in general, this platform will be open for anybody.
And that also makes me think of the research in general that the European Joint Program in Rare Diseases is doing. You're involved in, I imagine, a lot of research projects. Are there a few that are ongoing right now that are ones that you end up talking to the public about, or is this really more classified information until it hits that clinical trial phase or something?
No, it's not. It's not confidential. What you need to understand is actually that EJPRD is on one hand by itself doing research. So inside of the EJPRD, for example, what I was just talking about, the creation of the virtual platform, it also requires, for example, development of some specific pathways to accelerate the diagnosis of undiagnosed diseases. And that actually means that, for example, bringing together the data from genomics, but also from toxicology. It's something that hasn't been necessarily done before, or from epidemiological data. So exploring the way, how can you add some specific, let's say, data to something that is, let's say, more classical way of analyzing, is something that this type of research, for example, is happening inside of the EJPRD. But then we also have, as I mentioned, we also have funders on board of the EJPRD, and it means that actually, we are launching yearly funding opportunities to finance research projects on rare diseases. And this can be in different types of, let's say, topics. So we, for example, just closed and announced the 22 projects that were financed this year from a call that was announced 1 year ago. And these are, for example, fostering mostly natural history studies, pathophysiology, the establishment of registries for rare diseases. And since actually we are not necessarily focusing on a specific rare disease, but the calls are really open for the rare diseases, let's say for any rare disease with few, let's say, exceptions, that means actually that the projects that we are financing can spread from rare disease like cystic fibrosis, for example, to the one like progeria. So it means that also in terms of prevalence, it may be a rare disease, let's say, that is more common to the one where you have only a few patients in the world. So it's really more about, I would say, the excellence of the research consortia that are coming together, the goals that are the way the project is being presented, and of course the impact it can make on rare diseases community and patients.
So you're definitely perking people's ears up that have a rare disease organization. They're looking to start funding for research for that specific rare disease. Are there requirements for these organizations to apply for, I don't know if grant is the right word, but is there certain requirements for someone to be able to apply, to be in the running, to maybe receive this funding?
Yes, so there are some requirements, and it depends also on the type of funding actually they want to apply for. Because if we are talking about the funding opportunities for what we called multinational research projects, these are, first of all, multinational. It means that you have to have a consortia that brings together at least 4 different countries. But then it is limited to the countries that are part of the EJPRD. So, for example, mostly this will be those, let's say, 30-something countries, depending also if their funders participate in the program or not. But then there are some other funding opportunities that are maybe not necessarily targeting research, but for example, the networking. We just opened one like that. And so this is more about, creating the networks, expanding the existing networks to spread the knowledge about rare diseases. And here again, let's say the main applicant should be somebody from a country that is part of the EGPRD, but it doesn't mean, for example, that if they want to organize a networking event, it cannot happen in a country that is not part of the EGPRD, because really the goal here is to build the community and to allow the rare disease community to bring together, for example, to enhance the participation of patients in research and so on.
You're looking to support that research that people are already involved in the program or maybe becoming involved in the program. You mentioned before cystic fibrosis, progeria as being some of the rare diseases out there. Are there any research projects that come to mind that you've been involved in the past year, just to give people an idea of like what this research project kind of looks like?
So the research projects that are being financed, as I mentioned, these are usually the projects actually the topics can be really different. So we have the projects that are, for example, fostering the development of novel therapies for rare diseases. And it can be a preclinical research, which means, for example, identification of a, let's say, novel biomarker to accelerate the diagnosis of a specific rare disease. It can be also, identification of a specific molecule that is very promising, and then, doing the specific, let's say, tests on an animal model to then push this molecule further into the development and to find a specific sponsor that we can also help in that. So these are the type of the projects, for example, that we finance, and there are some in which, because actually, as I mentioned, EGPRD started in January this year, but actually, especially this funding activity is something that is a heritage from a different program that was existing before, which was called ERAR. And this program existed since 2006. So, and on a yearly basis, they were launching funding opportunities. So there are many, many projects that were financed and that finished either in a clinical trial or, for example, in the establishment of the new diagnosis guidelines, or simply also on the advancement of research on a specific rare disease that had, for example, not knowledge about before.
So many different phases of research that you're talking about, either, as you said, there is no research on this specific disease, or you're looking at such a specific aspect of that rare disease. So it's cool to see that it's not just one area of research that you're doing, but really a general overview and different portions of that. I'm curious, how are these research projects funded? Like, can companies and organizations invest in this research to become part of this?
So the majority of them is being financed through the public funding. So actually the way it works is that the public funders, so funding agencies or funding institutions, like, for example, the equivalent of NIH, are coming together. And usually there are more than 20 of them from different countries, coming together and sitting and deciding together on, first of all, the topic of the call that they want to launch together. Then they agree together on the evaluation procedure. So there is a unique evaluation procedure for those projects, and they put on the table specific budget. And so all that then contributes to the funding opportunity. And at the end, those consortia, the way at least it works for the multinational consortia is that each country is financing the research teams from their own country, which means that actually the money it's not like a real common pot. So the money doesn't travel, or it's not being put, we put our money all together and then you finance whatever you want. But it's really, to, I would say, enhance the multinational cooperation, but also, and this is quite often easier for the public funders, is that if they can support, their national teams, then it's easier also, to get, let's say, higher investment in the research projects. So this is the way it works on the public funders side. Now, regarding the companies, for example, so we have never had a common funding opportunity where on one hand we had companies and public funders. So there was no public-private partnership. This is something that actually we are just starting now. So we just opened again a new funding opportunity, which we called Rare Diseases Research Challenges. And this is a cooperation between public and private stakeholders. So we actually have the companies that set up the challenges. These are the challenges that must be solved within maximum 30 months. Of course, these challenges must be with a benefit for patients. And the academia or small and medium enterprises can come and respond to those challenges. And the funding is joint, which means that we, as the EJPRD, are bringing a little bit of public funding, and then the participating industrial partners bring also their part of the funding, with the promise that the projects that at the end are going to provide the solution for the challenge. This solution is then will be uptaken by the industrial partner and developed further.
So much collaboration between the countries to be able to have this money and divvying it up between lots of different research projects that you're going through. And then also exciting to hear that you're including other, more of the private side to be able to become involved in this, because, the more research funding we're able to get, the further research is able to go. And I think that seems to be really one of the benefits of having the European joint program with rare diseases, because you're able to really come together, and the larger you are, the more you're able to get done and have all of these really ambitious goals. And I think one of the exciting things in the rare disease community is when we see that a treatment is available for a rare disease. And one that's been in the news, the past year or so has been Spinraza, which hit the market for people with spinal muscular atrophy. And I was so excited when I heard about this and talking about it with other colleagues. And then I was shocked at how much this costs. I mean, I don't know about in Europe, but I know the U.S. retail price is like $750,000 for the first year, and then it's $375,000 for the next year. It's so exciting that we're getting to this point of having these specific treatments. But I get concerned about, okay, then it's going to be so much money and only so many people are going to be able to afford this. And I don't even know how insurance works with all of this. But from your perspective and just with all the experience you've had, is there a way that we can start combating these exorbitant costs and being able to lower this? Is it really just being able to put more money into the research side and then we're going to get to this? Or I don't know if you have any insight of just how we're going to be able to look at this in the next 5 to 10 years as more of these treatments are coming to market.
Yes, so this indeed is a big problem, because in a way, on one hand, there were quite, let's say, a lot of encouragement from the FDA side or from the EMA side, so European Medicines Agency, that put, some specific orphan drug designations to enhance to encourage industry to work on rare diseases. Because, if you think about a pharmaceutical company, obviously, they need to at the end make some profit. So if you think about that, the drug will be available only for, will be targeting like only hundreds of patients, then it means that you invest really, really a lot of money into development, let's say, of this drug that usually takes between 10 to 15 years. And then there will be only like hundreds of people that are actually going to benefit, because there are only hundreds of patients and not more. So, but this still, of course, let's say, increased the interest and the development of drugs. Although if you look at it, only 5% of rare diseases actually have a therapeutic option today. So it's really not a lot. And then there is this problem of the price. So there is actually quite a lot of, I would say, work that is already going on how we could see or try to make a change in this pricing. Obviously, it's not something, that it's going to be solved within, I would say, 2 or 3 or maybe even 5 next years. But the good thing is that we are working more and more with the regulators, with the health technology assessment agencies, with all this, let's say, with the payers. So all the stakeholders that are involved, to fix the price at the end and to make the drug available also for the patients. Because for many, and in Europe it's even more complicated because, as you can imagine, we have many European countries, and actually we do not have a common rules in terms or pricing for all those countries. So it means that actually you can live, let's say, in France and have an access to a drug in France, while in Germany, for example, it's not going to be available. So it's even more complicated, I would say, in Europe. But there are a lot of initiatives, and I would say that patients are really very, very important in this dialogue, and helping, let's say, into accelerating of the discussions between the industry, between the policymakers, between the payers, to be able to see what are the solutions in terms of a, let's say, right price for the right investment. So there is also a question of the transparency of how much is the real investment, for example, in the development of specific drug, but also in the alternative models of drug development. Because the problem is that if you can put, many different incentives, but if at the end you have only 100 patients all over the world that have a specific rare disease, then you can, put whatever you want as incentive, and probably there will be nobody who will be interested in developing the treatment for those hundreds of patients. So we need to think also about the ways, how we can now develop other ways of drug development that may be less industry related, more maybe patient driven, more with philanthropy driven, for example. But also publicly driven, so developed by academia, developed by the member states, that would be less, let's say, industry dependent, in case we really want that all the patients have exactly equal treatment and the possibility to access the treatment and diagnosis and live their life as well as we can ensure them.
And it takes a collaboration like the European Joint Program in Rare Diseases to be able to start accomplishing these goals, and having all of these people come together for so many different perspectives to start solving issues like these. I mean, it's kind of in some ways a good issue to have. We have this treatment, so it's being able to figure out the financial side, but at least these treatments are happening, this research is happening. And I just want to thank you again for coming on the show to be able to shed light on this, especially with the European perspective. And I'll have to look more into the complexities of that. It's a little bit more complex over there in terms of those countries. I didn't think of that before, and kind of sometimes just in the US, and I'm thinking of it that way in terms of our insurance and everything. But thank you so much. It's been a pleasure to hear from you and learn a little bit more about rare disease community, more of an international perspective. And I'm sure there'll be lots of follow-up questions and ways that we're looking at the rare disease community changing in the next 5-10 years plus. So thanks so much for coming on the show and sharing all of this with us.
Thank you. Thank you very much.
To learn more, you can go to ejprairediseases.org. Again, that's ejprairediseases.org. And if you're interested in listening to more podcasts about rare diseases, I have so many in this podcast. You can go to dnapodcast.com to access all of them, or wherever you're listening to this show, podcast app or the radio. You can go to dnapodcast.com and access that. I have episodes with patient advocates, researchers, doctors, recaps on rare disease days over the years from Connecticut and Hartford there. So lots of information if you go to dnapodcast.com or search DNA Today in your podcast app. If you are on Instagram, you can follow me at DNA Podcast. If you're on Instagram and more of a visual person, you can follow me at DNA Radio. And any questions you have for myself or any of my guests that I've had on the show, you can email into info@dnapodcast.com. I love hearing from you listeners. It's great to be able to connect, and really appreciate if you have any comments or questions about the show. And I want to end just saying, again, happy Rare Disease Month and Day coming up. If you're in the US, you can get involved by going to National Organization for Rare Disorders website, rarediseases.org. Again, that's rarediseases.org. You can find ways to get active on social media by sharing certain promotional images. And there's also a lot of in-person events happening all throughout the US. So you can go to rarediseases.org to find all of that information and more. Before signing off, I want to remind you about Keck Graduate Institute's master's program in genomic data analytics. KGI is an innovative grad school that is a member of the Claremont Colleges in Southern California. Their name might sound familiar if you listen to the genetic counseling application episodes with Brenna, who's one of my friends that's a student there. In addition to genetic counseling, KGI also offers this master's degree in genomic data analytics. Students benefit from foundational coursework in human genetics, cutting-edge courses in the applied life sciences, and an innovative human genomics curriculum that combines to prepare for the exciting field of genomic data analytics. Upon completion of the program, students will be able to utilize their foundation in genetics and genomics, along with the practical knowledge of data analytics, to be able to translate patient sequencing data into actionable clinical recommendations, and also be able to bridge the gap between research scientists and clinical practitioners. Graduates of the program will gain the ability to translate research into precision medicine. Learn more about KGI's genomic data analytics program by visiting kgi.edu/DNA today. Again, that's kgi.edu/DNA today. Thanks for listening, and join me next time to learn and discover new advances in the world of genetics.
The genes of you and me, genes of you and me, they're all made of DNA. We're all made of the same chemical DNA.